We are honored to be joined by Dr. Amisha Malhotra, a Pediatric Infectious Disease Specialist at the Bristol-Myers Squibb Children's Hospital at Robert Wood Johnson University Hospital and Rutgers Robert Wood Johnson Medical School. Good to see you, doctor.
Same here. Good to see you, Steve.
You know, it's so interesting. We're doing this on the 28th of September, being seen later. Pfizer, lots of things going on as it relates to vaccines for children 5 to 11. Tell us exactly not only where we are, but more importantly, where you think we're going as it relates to vaccinating our children.
So as you all know, just a couple of months ago, Pfizer had actually gotten an EUA, which is an emergency use authorization to vaccinate children ages 12 and older. So we've had our approval for people who are 18 and over, and we recently got in what we call an emergency use authorization. So the emergency use authorization was given to the Pfizer vaccine to vaccinate children ages 12 and up. And that was a couple of months ago. And so then we're asking, well, what about our younger kids? You know, when will we have a vaccine available for them? And one of the issues I think that many of these companies deal with is what's the right dose for children under 12? So how do we get the most effective or the most efficacious vaccine and give them the right dose? You know, children are not young adults. So that's where
sizes. Our daughter is 11. She's tall. She just got her checkup, you know, all good. But she's tall. She's bigger than most 11-year-olds in terms of size and whatever. But I'm sitting there going, so how do you measure the amount of vaccine? Because some kids, 11, 10, are bigger than small adults.
Right. I don't think it's all just about weight. It's also about the immunity and the immune response. And we know it's not just height and weight, really. So that's actually why there's been a lag with vaccines coming out for children under 12, because that's what these companies have been doing. They've been trying to figure out what's the optimal dose. And I think many of you may already have heard that Pfizer has actually, probably within a couple of days, is ready to submit their data.
As we do this program.
As we do this program to the FDA for at least emergency use, if not approval, to get the vaccine available for these children under 12. I think the dose is probably a third of the adult dose.
Okay, I'm going to follow up on this. By the way, check out NJ Spotlight News. Our former colleague at the Caucus Educational Corporation, Joanna Gagis, did a great report talking about different views of parents on this. But one of the parents she spoke to speaks for a lot of parents, many whom said they can't wait for their children, us as well, my wife Jen and I, when our daughter is eligible, we will. That's what we choose. But there are a lot of parents who are like, and this was in the report, some of the parents are like, no, it's been too soon. It's not enough. It's only been a few months. Talk to all the parents who are saying, yes, whether the government approves it, the FDA or not, I'm not doing it for my kid. What would you say to them?
So, you know what? I think it's important for parents to be advocates for their children. No question. As a pediatrician, as a mother, I understand that. But then, you know, I hear this a lot. Oh, it's too quick. It's too soon. And you have to understand that vaccine development, and specifically COVID vaccine development, wasn't just something that they whipped up and went through and said, we're not going to follow protocol and policy. That never happened. Yes, it was emergency because we had a global pandemic. So things that normally maybe take years were prioritized. That doesn't mean steps were missed. That doesn't mean safety wasn't looked at. That doesn't mean an adequate number of people, people who volunteers, the studies were not done. Same with children.
No shortcuts, doctor.
No shortcuts, but priorities. Okay, so 10, 20 years ago when you probably had, 30, 40, 50 different items on the docket saying we need approval for this, stay in line. This was, hey, look, this is a global pandemic. This has to be the number one priority, and we have to go through all the steps. And that's why it was done sooner. It doesn't mean that there were shortcuts taken.
But doctor, you've seen this. Tell folks exactly what you're seeing. By the way, as we talk, the twindemic, if you will, COVID, the flu, other diseases that we have to be aware of. Tell folks exactly what you're seeing in our hospitals as it relates to children and COVID, because this isn't someone's opinion. This is a reality. Please, doctor.
Sure. So, one of the things I always hear from families, from parents is, well, kids don't get COVID. That's not something I have to worry about. So why should I worry about this? Because We're not hearing that children are getting COVID. And I can tell you, as a practicing physician, as an infectious disease doctor dealing with children, yes, children do get COVID. Now, I will say, though, that the hospitalization rates of children are probably not as high as adults, okay? But that doesn't mean they can't transmit disease. That doesn't mean they can't get disease. And that doesn't mean that they can't get hospitalized and get severe disease. There's a condition called multi-inflammatory syndrome in children.
I'm sorry for interrupting, Doctor, because of time. Long-term implications, if a child does have COVID, there may be with certain children longer-term issues, correct?
Yes, absolutely, like there are in adults. Now, again, like I said, we know the hospitalization rates aren't as high, but certainly we are seeing very, very ill children in our ICUs. So, from a medical perspective, I think it's important for people to realize that this disease affects anyone, everyone across the board, young, small, old, whatever, and we need to protect ourselves.
Before I let you go, Doctor, I have to ask you this. We're talking about physical health, medical health in terms of, the sickness and what the potential implications are of children. Please talk about our children for 19, 20 months going into this pandemic and beyond, the emotional and mental health issues for our children, which you deal with as well, please. Left.
Yes. I think we have to understand that this has taken a toll on all of us, but especially our children. Think about the social isolation. I mean,
my daughter
children
walks around with a plastic shield. I'm sorry for interrupting. All day, she walks around with a plastic shield. Yes, she wears our mask. We thank our teachers and everyone in our school system. But I just think to myself, yes, we have to protect her, but she's not seeing the kids. There's no facial connection. The socialization is not the same. That has implications as well, no?
Absolutely, it does. We've seen that. We've seen these children kind of suffer in silence. We've seen children who are unable to go to school. Many of these children get their meals at schools. Okay, so they were home for about a year. Many of these children who need services that they get in schools families were unable to get those services. And in general, children need friends. They need to socialize. They were unable to do that. There's only so much you can do in a Zoom meeting. There's only so much you can, especially for a 6-year-old. I mean, they don't have the attention span to sit in front and wave to their friends. So that's
when they get vaccinated, will they be more able to play together, in your opinion, Doctor?
I think we are opening the doors to leading a more normal life. The more we vaccinate, the less we see this disease and the more normalcy will happen. And that's exactly my hope. And that's why I'm advocating for vaccination, not just for the adults, but for the children as well. We need our lives back.
Hey, Doctor, I want to thank you so much for joining us. By the way, when I was talking about this large plastic shield our daughter carries around with her, it's for her protection and the protection of everyone else. I'm not in any way being critical. I'm just saying that's just part of with the books and everything else and the mask. It has to be done, but let's not kid ourselves.
Well, there's a new study that just came out from the CDC just a few days ago.
Real quick, 20 seconds on it, go.
Masks help decrease infection in schools. They do. Bingo.
That's not a political opinion. That's a medical fact.
That's a fact. And we've shown it.
How dare we bring facts out here on public television? Hey, Doctor, thank you so much for joining us. Wish you all the best.
My pleasure. Thank you.
I'm Steve Adubato. Thank you so much for joining us. We'll see you next time.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by NJM Insurance Group, the Turrell Fund, supporting Reimagine Childcare, Wells Fargo, the Robert Wood Johnson Foundation, the New Jersey Board of Public Utilities Clean Energy Program, PSE&G, Choose New Jersey, Community Food Bank of New Jersey, and by Georgian Court University. Promotional support provided by AM 970 The Answer and by NorthJersey.com and Local IQ.
We are the Community Food Bank of New Jersey, and we are there. We are there for more than 1,000 food pantry and feeding program partners. We are there for our neighbors in need, nearly 1 million of them who struggle with hunger. Working together with volunteers, partners, and donors like you, we fill the emptiness caused by hunger with food, help, and hope. We are CFBNJ, and we are there. Join us. Go to cfbnj.org now.